Okay, welcome to the Los Angeles City Health Commission meeting, Monday, April 10th, 2017. We would like to get started. Clerk will please call the roll.
Griffith, Hisrich, Hawkes, Cotto, Shannon,
Here.
Sharp, Vic. There's 7 members present.
So we do not have quorum yet, but we are going to start with our presentations on health-related cost programs and policies. We'd like to welcome Laura Trejo, who is the General Manager of the Department of Aging for the City of Los Angeles, speaking on the health and wellness programs for seniors. Welcome. Thank you.
Good afternoon, and thank you for the opportunity to speak before you. I'm going to provide you a brief introduction to what the Department of Aging does, and also some major trends in health and aging, and then discuss some of our programs. The Los Angeles Department of Aging is both a municipal department, but it's also a federally designated area agency on aging. Under that federal designation, that's part of the Older Americans Act, which is a federal law that institutes financing for older adult programs in communities. As an area agency on aging, we have 3 basic core functions. One of them is to mobilize the voices of older adults on their own behalf, or to become the voice of older people if they are not available to speak on their own behalf and on their own needs. We also have a very strong mandate around strategic planning. Area agencies on aging, because of the dramatic shifts in the older adult population, were envisioned to be local level community organizations that would stay at the forefront of the changing needs of an older adult population. So every 4 years, we do a very robust strategic plan that basically informs how we will operate all of our programs and finance all of our services. Part of that process is also needs assessments, which we conduct in a variety of settings and in a variety of areas. We also have a responsibility to develop services and programs that meet the needs of older people. Part of the work that we do is on 2 different levels. We are advocates to other systems, and we also help to mobilize our limited resources to make the biggest gains on behalf of older persons that we can. So for example, I may be working and advocating for more mental health services, which we would not finance, but I want to make sure that they're specifically targeted in abundance so that they meet the needs of older persons. Area agencies in our department really are there to assess community needs. We develop and fund programs. We do a lot of education, and we also deliver direct services through our network of contract providers. We also serve as portals of care. While most of our services are social support services, we also help to link older adults to other services that they may need in the community. And we really do a lot of development of provider expertise by providing technical support and assistance to make sure that we have the capacity in our community to serve the needs of an emerging older adult population. Currently, we administer citywide about 162 unique programs throughout the city that serve an estimated 250,000 unique clients a year. For example, our biggest program, which most people are familiar with, are our meals. We provide not only congregate meals at over 80 sites citywide 5 days a week, but we also deliver home-delivered meals to about 3,500 seniors every day, 5 days a week. So on an annual basis, we're delivering somewhere in the magnitude of about 1.5 million meals to older adults at very high risk in our community. We're also responding to a wide array of information needs. For example, we respond to about 50,000 calls a year from older adults and their family members looking for services and assistance in providing those supports. Our services have a wide-ranging impact in the community, all the way from nutrition, case management. We also have family caregiver services that provide support to those caring for seniors. We have programs that address the legal needs of older adults, elder abuse and protection. We have we operate directly out of our office, a senior employment training program. We do health promotion, which I will discuss in detail today. We also have transportation and other services that provide support for maintaining your independence. Older adults, I wanted to start by a definition of what is aging, because most people think they know what I mean. Most people don't know what aging means. For us, the definition of an older adult is anybody over the age of 60. But within that segment of the population, we're talking potentially a 40-year part of our lifespan. So we actually have to be very focused on the unique needs of younger older adults. Those people who are 60 to 64 are uniquely different than those who may be 75 and 80 and those who are 90 plus. So part of the work that we do when we're developing programs is to really target and tailor to which part of within the aging population segment we are trying to address a need to. We are seeing an increase in centenarians and what is also called super centenarians. People over the age of 110 are becoming more and more common in our community, which is also setting up challenges for all of us, because those are extremely unique individuals in our world, basically. Los Angeles is home to an extremely diverse older adult population. We actually mirror the demographic makeup right now. The city of Los Angeles is what California's older adult population would look like in 2030. So part of the challenge Los Angeles has is that we are really leading the state in the challenges that a very diverse older adult population places, because there's not a lot of other locations within California that have the mix that we do. So we actually, part of our work is making sure that our services are linguistically, culturally appropriate and accessible to the clients that we're serving, and also learning about emerging new populations in the community that really perhaps were not very visible before, but have been aging in place. And so those also become part of our ongoing learning to try to figure out with those communities how they define aging, what are their challenges, and what are the opportunities for us to be of service and support. Currently, Los Angeles is home to over 620,000 older adults over the age of 60. 58% of them are considered ethnic minorities, meaning that's the level of diversity of our community. They represent over 92 spoken languages and dialects. So when we're thinking of accessibility, we also have to think of linguistic and cultural accessibility for our programs and services. And our network reflects that. Part of the work of the Department of Aging is really to work with neighborhood-level community-based organizations that are mission-driven in serving older people, because we want folks that reflect the clients we're going to be serving. Right now, in terms of healthcare, we are seeing a major transition, as this commission, I'm sure, is very aware, from the acute care to chronic care. As the population is aging, it's really driving a dramatic shift in healthcare overall. For example, one of the things that we're looking at is, as the population aging, they are aging with more chronic care conditions, but they're also aging with multiple chronic care conditions. And so part of our challenge is really how will we serve a community that is experiencing not only a level of chronicity, but a multiplying effect because of all of the issues associated with it. We're looking at conditions such as diabetes. We're looking at issues, for example, Alzheimer's, which is moving in the cause of death in Los Angeles County. Concern to us in terms of how are we creating dementia-capable services in this community. We are also looking at the cost implications of health and wellness. When older adults do not have readily access to care, they end up in emergency rooms, which are the most highest levels of cost in terms of delivering care. But one of the things that happens is oftentimes systems don't become involved because it's not their cost. We become involved because what we care about is the quality of life of the older person. And so we actually, part of our internal analysis and strategic thinking is what will we deliver to the community that actually is in the best interest of the older person becoming most independent and most well. And so that's part of our driver. We actually are looking at issues related to hunger, to health. We're looking at issues related to economic security and how all of those interface in predetermining wellness in older adults. As we all know, many of the determinants of health have to do less with your chronic condition and more with some of the social determinants. And so at the Department of Aging, one of the things that we have developed is a framework for looking at health and how we engage, because at the end of the day, we kind of have to have our own map of why we're involved in some of the work that we're doing. And we really do believe that many of the services that we deliver are root cause services that can redirect. For example, nutrition is a major problem that affects or creates more challenges if it's not controlled as part of chronic conditions. So we believe we have a major role as part of one of our biggest services. And so educating older adults about good nutrition is important to us, because we know that that is one of the ways that they will help to manage their health conditions long term. We also are very involved and have been since 2003 in the whole area of evidence-based health promotion programs. The department was a pioneer on a national level in implementing and delivering evidence-based health promotion programs for older persons. We are very proud to continue to be one of the leaders nationally in that area. We've pioneered work in, for example, one of our signature programs is Active Start, and that program really increases the ability of older people to stay independent, increases their mobility, and has some really robust effects over time. That's part of evidence-based programs. And I actually shared with all of you a handout. In it, you will see the programs that the department supports through our evidence-based health promotion programs citywide. Not all of the programs are offered in every area at the same time, but that is the menu of programs that our providers have to choose from in providing, because we needed, because of the size of Los Angeles, we wanted to give some flexibility to the local communities to choose which ones were the better ones for their constituents to provide those services to. So we provide technical support on those particular programs. All of those programs have been scientifically tested, and they actually have demonstrated that if the older adult goes through the program, that you have an expectation of certain outcomes that will occur. And those have been studied, and so we feel very confident that when older adults take those programs, they actually do quite well. And we have some very excellent examples continuously of older adults that have done remarkably well. You know, one of my favorite examples is of an older adult in East Los Angeles who came to see the program staff, and she kept saying, "I think I forgot something," and they were like, not sure what. And finally she realized she forgot her cane on the first floor and had walked up an entire flight of stairs, something she had not done for years. And so she kind of surprised herself. And that's because she had been participating in one of our arthritis Walk with Ease programs, and she had been very active in a walking group. It was literally changing the quality of her life. These programs do that. And so we're very happy to support them and to continue to promote them. On an annual basis, right now, we have about 3,500 older persons throughout the city of LA that participate. These are very rigorous. You have to be there sometimes 6 weeks in a row, 7 weeks in a row, 10 weeks in a row. And our participation and retention rate is in the 80%, which we're incredibly proud of, because it means that people are getting what they came for, and so they stay. And so that's why we believe so strongly in evidence-based health programs. We also have been pioneering work about how to engage older adults in activating themselves into seeking health promotion and health wellness programming. That's very hard to do. For many seniors, getting through the door is the hardest part. And so we've been trying different strategies to try to create opportunities for older adults to come to our centers. For example, we're very proud of one of the projects we were very involved in. It's called Exer Gaming, where we actually use the Xbox, which is basically a toy for young people, but we use the same activities to bring seniors to the centers. One, they're learning the technology so they can talk about it with the grandkids, but two, they're also involved in bowling and hip hop and all kinds of dancing and things that they do as part of it. So it's a lot of fun, and what we invite them is, please come and be part of these clubs, and while you're here, then you get to learn about some of the other services that we may offer. And that's been a very good feeder for us to identify new individuals that come and participate in our programs. One of my favorites is that for a lot of our agencies are starting stroke clubs, because the Xbox, you don't require to lift anything to participate, so they do bowling a lot, and they have a lot of fun, but people are socially engaged, but they're also moving. So it has some tremendous results for us on a social level, but we know that it's making them feel better because they're getting out of their house, they're involved, and they're doing an activity that they enjoy that they thought that maybe they didn't have to do, that they couldn't do anymore. So those are the ways that we're trying to use even off-the-shelf technology to look at ways of improving health outcomes among the older adult. We also are working with within the community to mobilize health providers to be more attuned to the unique needs of an aging population. In 2013, we actually launched a partnership with the Department of Public Health of LA County, Partners in Care Foundation, the City Department of Aging, the County Department of Aging, and Kaiser Permanente to launch the Los Angeles Alliance for Community Health and Aging. In less than 4 years, we now are boasting over 100 members. And these are people that are working in health clinics, health programs, prevention programs, hospitals, all kinds of healthcare environments that are coming to become trainers, leaders, facilitators of health and evidence-based health promotion programs for older people. So we are constantly looking for how to mobilize our community in terms of improving the health outcomes of older persons. The other thing that we do very actively, the Department of Aging is a foundational partner of UCLA, and we actually put together the La Capra Center, which is an applied research center, which allows us to do a lot of evaluation of the work that we do. We also are very active participants in the Healthy Aging Initiative, which is a partnership of the scientific translational science centers, both at USC and UCLA, where we're looking at ways that we could evaluate programs in the community from the ground up. So it's very empowering because we get to ask the researchers the questions, and it's their job to try to figure out how to get us some answers. And that's been a really important piece for us, to be involved from the ground up in working with our colleagues in academia, because to us, we're also consumers of research, so we want to be informed consumers of research. Most recently, I wanted to share with the Commission, in May of last year, Mayor Garcetti and the Board of Supervisors launched Purposeful Aging LA, which is a designation that we received from the World Health Organization to become an age-friendly city. Actually, we're an age-friendly region because it includes Los Angeles County as well. The vision of Purposeful Aging Los Angeles is to make the Los Angeles region the most age-friendly communities in the world. It's really to mobilize our entire region to look at ways that we can improve how we make the aging process, aging in place, more user-friendly for older people. In that regard, we are right now embarking on a very robust needs assessment of the needs of older adults. Phase 1 will be city and county employees who will be, at the end of the day, the architects of this initiative. We're actually asking them what they think of aging. In phase 2, we're going to go into the community and do the same thing with older adults and other members of our community. And we're also hosting, I think it's 11 listening sessions across the entire county. And all of those will come together to give us some on-the-ground information about how to build some recommendations and action planning moving forward. This is a 5-year process that we're currently involved in, and we're very excited. We're kind of at the early stages, so I don't have a lot of outcomes to share with you, but the process so far has been incredibly supportive, and we have seen such excitement across the community of people wanting to be part of this. So I hope you will invite me back in the near future when our needs assessment is done, so I can share with you some of those results, some of those trends, and also engage you in helping us to identify action steps that this commission can be involved with. That, in a nutshell, is what the Department of Aging does, what we've been doing around health and aging, and I would be happy to respond to questions.
Thank you so much. This sounds wonderful. Any questions from the commissioners?
Yes, sir.
Commissioner Cotto?
Thank you. Thank you for taking the time to come in and present to us today. You're talking about, outreaching into the communities, and it's a big city.
Yes, sir.
Are you working through like the neighborhood councils?
Yes, we are.
And there are some that are a lot more active than others, right?
Mm-hmm. Yes. One of the very exciting things right now, for example, because of purposeful aging, neighborhood councils have committed to identify a liaison in each one of them for us. I think we're already like 2/3 there, so the response has been tremendous. The department has always worked in partnership with neighborhood councils, but I think now we're kind of taking it to the next level with this initiative in terms of the ability to really develop a two-way communication process for sharing information and mobilizing one another. We also, as a result of our reaching out to them, a couple of the neighborhood councils are now starting committees on older adults, which is very exciting to me, which means we're going to have a lot more investment from the local communities about the needs of older persons. So we're getting prepared to the request for them to be supportive, because that's what we've offered, that we're willing to support them if they're willing to work with us in part of this process. So we have always had a very robust partnership with them.
Okay, thank you.
Thank you.
Any other questions? Okay, Commissioner Sharp?
Thank you for joining us. I had the opportunity to take my mother to the ribbon cutting of the enormous senior center at the corner of Sunset and Alvarado, which was a fantastic event.
Yes.
It garnered extraordinary political support and must have taken a lot of resources to pull it off. And so my question to you is quite simply, how do we know what the ROI is on that? Mm-hmm. What's the return on that sort of investment? Mm-hmm. And how is that measured?
Well, let me share with you on multiple levels. One of the unique factors of the Department of Aging is that we're a grants-funded department. So every money pretty much that we touch has deliverables attached to it. We have to be accountable to the federal government, to the state government, and to the city government who funds us. So we have metrics for everything that pretty much that we do, because we operate out of a very robust strategic plan that's approved by the state of California. That's very unusual, I think, for most organizations to have that level of accountability. We also have a great deal of review attached to it. The state monitors us on an ongoing basis across all of our programs, and they actually have technically expert staff that can do deep dives on specific programs that are the most important to the network. So, for example, when my nutrition programs are being evaluated, they're not evaluated by an administrator, they're evaluated by nutritionists who come in here, and that's their expertise. So a lot of our feedback from our state partners really is one of the ways that we do a continuous quality improvement of our programs. They're constantly being looked at. So that's one level, which is what we have contracts. We also have third parties that are coming in to review the process. Internally, we also, as part of Mayor Garcetti's initiative to look at measuring the social impact of all of our services, we embarked on a very aggressive process of developing a performance outcomes system for our providers. We actually, on a quarterly basis, are meeting with our providers, and we actually have a peer review process where we put information out on a particular program, and all of the providers from that program are not only either sharing challenges, but sharing solutions to how to make those programs better, how to make them more cost effective. If they are having a problem, they can consult immediately with the peers that are there. I based it very closely on the LAPD model of CompStat, which is a peer feedback process rather than a gotcha process, because we have that in a different room, with our contracts monitoring. In the performance outcome is really about improving quality and challenging our providers to always keep sort of their eyes up, and how do we provide more quality and more improved service outcomes experience for the client. And so Echo Park is no different than any of our other centers, where we have extremely high expectation of our provider in terms of the kinds of services they deliver. At Echo Park, we have slightly higher, because one of the things we want to do there is to really use, because if it's a smaller size, we're actually trying different strategies there that we're then able to replicate if they work in the entire network. And so one of the challenges we gave to our provider there was to be open to being a center of excellence, as it were, where we can test. For example, right now we're testing a small transportation pilot project with them. We've tested other pilots in the past, and that's how we learn how we can take things to scale, or maybe how do we tweak them so that they can be taken to scale. But we have to be able to try it somewhere, and most of our centers are very large to do that. Echo Park is just perfectly sized for that. So we've been doing that kind of work there, and we will continue to do that. It's a wonderful population. The seniors are incredibly engaged, and they're always up for a challenge to give us feedback. So that's been part of our vision for that center. So we're very proud of the work we're doing there.
Any other questions? So I have a quick question.
Yes.
How do most seniors access your programs? Is it? I'm guessing it's through the senior centers.
They can.
And then, what's usually the mode of transportation? Is it access, or do you provide transportation and try to connect seniors who have transportation issues?
So first one is people come to us through a variety of means. One is that they can directly access our services through their local multipurpose senior center. We have 16 across the entire city. So that's one of the ways. The other way is that they also can come through our website. They can come through our 1-800 number. They come through referrals of community social support agencies in the community. So let's say somebody is being discharged from a hospital, for example, they will give them our number to call us when they get home. Like if they need home delivered meals, for example, the hospital, if they don't connect them directly, will say, when you get home, call this number. Normally, they call the agency directly to make that linkage from the very beginning. So folks come to us from a variety of ways. I'll tell you the one that I least expected because of where we're located. People actually take the bus and find me at Figueroa and come to our office. So we actually do have a public counter at our office, even though we're an administrative site, because seniors do come there when they're in need. And so we're prepared to serve them there as well, even though that's not a focus or a goal that we have, but we understand that, when people have crisis, they would find you. And we also have all of our providers do outreach on their own as well to educate the community. One of the challenges that we have is that in the United States right now, every 7 seconds, somebody becomes 65 and older. So this is a very rapid growing population. So education and outreach is a constant need for us because folks may not know that we exist. And that's a common answer that we get. I just didn't know you were there. So we're constantly using the media. We're using radio, papers, brochures, flyers, any method that we can to let people know that we're here. So that's on the outreach part. On the transportation part, transportation is a very complex service. We do have a paratransit program that operates out of each of our multipurpose centers because we do have Prop A funding. Those are for essential rides, like to help some of our most frail and most needy clients be able to get to doctors, grocery stores, and other types of needs that they may have so that we can maintain their independence. Our agencies also do help older adults that they're working with to develop transportation access plans. So if they need, let's say, access transportation, they will help them make that connection because we have case management as well at the centers, so they work with the clients individually. We also educate older adults about the different ways that they can access transportation resources in our community. The pilot that I spoke that we're doing at Echo Park is really to be looking at on-demand. The whole world is moving to on-demand transportation like Uber and Lyft and all these other services. So there's a small program that has been developed really with older people in mind, and we're trying to figure out, would that be even a resource that would work for some of our clients that are more frail and more that need a little bit more attention. So we're constantly looking for the transportation gaps that may be in our community. And we're working with the mayor's office right now on doing a forum that we will bring leadership around to talk about transportation in the very near future.
Thank you so much.
My pleasure.
Comment
Oh.
to fellow commissioners. It's been a while since I looked through the plan for a healthy LA, but what was reported here is so important, and I don't think there was much mention of the aging, the purposeful aging in the plan for a healthy LA. Maybe we can make a recommendation to the city planning that somehow what was reported, these aspects get incorporated into the general city plan.
I think if I can add, in the city's plan, we actually worked with them when they were developing, and we were able to get two concepts in the plan which we felt were incredibly empowering to our work, which was a lifespan approach. If you look, it'll be in there, to the work of the city, and also to look at issues related to building robust age-friendly systems of care. So we worked very actively for those two very important foundational definitions for us in order to empower our work.
Okay, thank you.
Yeah, thank you.
Great. Thank you for coming. Okay, I'd like to welcome Shmel Graham, who is the director of the Mayor's Operations Innovation Team, and she will be speaking on health, wellness, and injury prevention programs to reduce workman's comp for city employees. And if your colleagues would like to introduce themselves, that'd be great.
Good afternoon. Thank you, commissioners, for having us this afternoon and allowing us to present on the work that we're doing. And I'm joined here by my colleagues, and I'll have them introduce themselves.
Hello, I'm Juan Vasquez, a data strategist.
David Parker, systems lead.
And so what I'll do is I'll provide you a quick overview of our team and the work that we're doing. So the Mayor's Operations Innovation Team is a public-private partnership in conjunction with the Mayor's Office, the Mayor's Fund for Los Angeles, and the Los Angeles Coalition for Economy and Jobs. And we were put in place about a year and a half ago, tasked with working on 3 areas of reform for the city, one being real estate asset management, workers' compensation, real estate asset management, procurement, and then here what we're to talk about today, which is wellness and safety. And so in our brief presentation today, we'll talk about the challenges that we identified within the city, the impact that that has on the city, achievements to date, and some of our goals as we move forward, and next steps.
All right, I'll quickly share with you all 3 kind of core verticals that we saw challenges before our team began work. So our team launched in fall 2015. And some of the main challenges that we saw was that incomplete reporting at the department level, so a lot of reporting up to the personnel department. And because that was inconsistent or it happened in untimely basis, it was really difficult to set citywide base marks and look at key performance indicators. Additionally, there was no citywide risk management tool. The safety division of the personnel department was understaffed. There was a lack of strategic planning, and really there was a need to standardize a lot of the way that department reviews happened at the GM level and then again a higher level at the mayor's office. Some of these challenges manifested themselves in the following way, which we see as a human impact and then a fiscal impact. So looking at the human side of things, the workforce, the people that make up our city, and arguably the city's most important assets, 18% of the city's workforce filed a workers' compensation claim. That means that for every 100 employees that the city had, 18 filed a claim. This led to 1.6 million hours in what's called IOD, or injured on duty. This is when salary continuation is happening, meaning they're not at the doctor, they're not getting medical or disability treatments. They're at home either waiting to get better or they could potentially come back to work in some capacity. Looking at the dollar figures, these costs manifested themselves as 2.5% of the city's budget. 60 million of this was paid out in salary continuation costs, and almost 220 million in medical benefits and stuff like that. And these figures reflect FY 14-15, just so you have that context. There we go. So now that was a little bleak, right? It's not a perfect situation. Let's look at some of the victories, achievements, and goals that we've accomplished in the last 15 or so months. And I will reiterate, the partnership with personnel has been pretty integral, great partnerships. So looking at data to start things off, we really leveraged an unideal data house. In the last 15 months, we've been able to get to the city to report best practice industry standard metric in claims rate per 100 employees. That is something the city did not regularly report on, and we're happy to say that is now part of the regular metrics the city looks at. It's something the mayor looks at. It lives on his dashboard, and it's a rolling 12-month average. So any given month, we can look back at what that number looks like 1 year back. I will show you all an interactive dashboard that we built to help really surface a lot of the metrics that the city had never looked at before, to drive discussion, create feedback loops. Additionally, we are running an analysis with Cornell University that is helping us understand what are the 3 profiles that tend to lead to high-cost claims. It is not any one variable that leads to a high-cost claim. It is a perfect storm of sorts that happens, where a multitude of factors come together. So we're working with Cornell's Applied Statistics graduate program to figure that out. We're also working with Cal State LA right here at home to help us understand or help us better predict if a firefighter gets injured based on the cause and the body type, how long he or she is likely to be out. And so that's one way. All this is happening pro bono. Some of our time goes to that, but these are incredible insights that can help the city not only keep their employees safer, but also reduce cost at no cost to the city. This is a look at the interactive dashboard that we built using a business intelligence tool called Tableau. There is a high-level interactivity that happens here. You can click into any one piece of it, and other portions of the dashboard will react. This is the first time the city had used this level of in-depth reporting, and we met with the top 8 cost-producing departments to drive dialogue with them. I'll now transition over to David. He'll talk a little bit about technology.
So for the risk management information system, the city chose Risk Connect. Incidentally, when deciding on a system, 2 of the key areas to consider are security and business continuity, and Risk Connect scored top marks in both areas. It's actually built on Salesforce.com's platform, and that's part of the reason. The system has modules for workers' compensation, litigation, property management, environmental health, and safety. So that means basically citywide we have all the risk and safety information in one place, and we can, rather than have these silos of information, we can look citywide, see trends, start to connect some of these things together, start to conduct root cause analysis and take corrective action.
So in February of this past year, the mayor released Executive Directive 18. ED 18, as we refer to it, is entitled A Safe and Healthy Workforce and Risk Management. It outlines a rigorous standard for managing risks for the city and creates additional level of accountability for employee safety and risk management. The mayor's risk reduction cabinet is one of the key things called out in the executive directive, and it invites participation from the city attorney and the city council president designee. It also increases the general manager accountability around risk and workers' compensation, and it also has for the CAO and personnel to provide administrative and analytical support to the cabinet. What you'll see also in the executive directive, there's a lot more called out for different departments to track data regarding risk within the city, to leverage the work that Juan and David have been working on to provide that type of insight for business intelligence and operational improvement for the city. And so Juan had mentioned our partnership with the personnel department. We work very closely with them, and so they have a lot of enhancements that they've done for their occupational safety and health division. And this slide here highlights some of their recent accomplishments. They added 3 new staff members. They have increased on-site safety inspections and oversights. They've updated and worked with different departments to update the injury illness prevention program and gathered citywide baseline for safety information. They have a very aggressive program that they're working on behalf of the city. And so some of their strategic goals for a safer future for the city's workforce include utilizing effective partnerships with the city departments and to look at how we can streamline safety efforts and leverage resources to ensure compliance with city safety policies and programs to advance safety improvements, and also to improve safety data and expand capabilities for safety analysis and evaluation, which is part of what they're doing with the Risk Connect system. And also there's the civilian wellness program development. And so the objective of that is to improve member health, establish trust, sustainability, and results-oriented efforts. And so really what the next steps are, convening the Mayor's Risk Reduction Cabinet, completing the project that we have with Cornell University and California State University at Los Angeles, going live with the Risk Management Information System, and operationalizing the different safety and wellness requirements called out in ED18, and exploring future staff and equipment investments needed to enhance safety and risk mitigation citywide. All the work that we've been doing is looking at the fundamental way to operationally improve the city as far as workers' compensation and other risk and liabilities to drive down costs for the city and increase savings. We're now available for questions.
Any questions from the commissioners? Commissioner Griffith?
What were your loss run reports like prior to you implementing what you're doing, and what do they look like now?
What was, I didn't
Your
understand the first.
loss run reports. These, you get reports from your carriers, your workers' comp carriers.
Right.
Okay. And prior to doing this, there must have been some concern because you had a lot of people, a lot of workers' comp claims. Have you noticed a significant reduction in the claims since you've been looking into the OSHA standards or not?
No, I think it's too early to tell because a lot of the work has been rolling out over the course of 15 months that our team has been in here, been in place. So a lot of it, the initial work we were doing is first capturing the data, understanding the data, finding consistencies. A lot of the challenges that we found is that data isn't standardized across the city, and really making sense of that, understanding existing city operations for all these different departments. Each department has different challenges based on the type of work that is performed. So a lot of it is investigation and understanding the lay of the land, different challenges, because departments have also been tracking this information in different ways, but there has been a better way to leverage resources during this time. So there isn't, right now, it's not, we haven't had enough time pass to measure that.
Okay, thanks.
Okay, any other questions? Commissioner Sharp?
18% was the number you cited at the beginning as the portion of workforce that filed a claim within the previous 12 months. Was that the time window?
The number I shared there was from fiscal year 14-15, and it floats around that still.
18% over the last 12 months.
Correct. In that fiscal year, it was 18% of the city's workforce.
What's the benchmark with other large cities?
So interestingly enough, there isn't. Cities are not very open about sharing some of these metrics. As you can understand, it involves private information, very, very sensitive information for their workforce. What we've learned is the national average somewhere between 9 and 11%. We're clearly past that. So right now we're just working on getting our stuff together and really understanding what the landscape is, and then slowly kind of coming closer to a national average.
And then one sort of detail of the mechanics that I know from another setting, there's a cost associated with determining whether it's a legitimate claim, and then there's sort of a treatment cost, and those are two separate phases in which someone's not performing the duties to which they're being paid and hired for the public. Is there some discussion about possibly combining the way that occurs? For example, if Kaiser is going to assess it from a workers' comp standpoint and going to provide the treatment, is there some discussion around how to tighten that time frame by combining who's doing the assessment and the therapy or treatment?
That hasn't been anything that our team has looked at specifically, because we've been looking at, even on the mechanics of things that the city can't control, is have departments properly followed the procedures for submitting claims, processing claims, following up with staff if they've been injured, understanding what their injuries are, if there are any limitations, how soon they can return to work. So there's even just a lot of standard mechanics that we've been focused on.
I'm talking about, I guess, something at a different phase.
At a
My
different
understanding
yes.
from
So
a
that's
few-
not something that we've looked into specifically.
next phase, I think there's an opportunity for you all to identify additional and significant cost savings to compress the sort of phase of diagnosis and treatment by combining the carriers who perform those functions. And in some cases, it's actually Kaiser on both ends, and there's a significant lag in which someone is just at home waiting to hear back for their appointment for PT when there wouldn't be any value in the city disputing and just sending them to PT on day one. There's some opportunity to compress that number of days out. I know this from a couple sources. Then because I guess, let me pause and recognize you're looking at it from a different standpoint, which is really the prevention and sort of measurement and monitoring. One initiative that the city adopted by executive directive over 5 years ago was a food purchasing procurement change to try and improve the food choices available for city workforce as well as for the public. And my understanding from another board commission on is that it just hasn't been fully implemented. And so I'm curious whether you've looked at a wide range of things that have been tested over the last few years to figure out why they haven't been. I mean, I think you wouldn't have difficulty finding people to say that different things weren't done. But in order to ensure that this new basket of recommendations is actually implemented, is there some process to try and figure out why previous efforts over the last decade were not fully acted on?
Yes, so our partners at the personnel department, they have their wellness program that they're expanding, and so there's a lot of research that they've conducted to understand policies that have been put in place before, why they haven't been as successful, and looking at outreach. So they have a whole unit that's aggressively looking at that and partnering with our service providers more specifically on wellness for city staff and other factors. So if you're hosting something, an event, you're not necessarily always providing donuts to staff members. There's other healthy food options. So there's a number of things that the wellness team and unit within personnel is looking at and exploring.
And just lastly, very briefly, is there anything we can do to help?
I would say to that point is looking at providing additional support to the recommendations that the wellness team has from the personnel division. They just sent out recently a citywide survey even to capture feedback from all of the city workforce. So I think there's a lot of initiatives that they'll be rolling out soon and recommendations that would definitely need some additional support or could use some additional support.
Thank you.
Thank you. Are there any other questions? Okay, thank you so much for coming.
Thank you so much.
Okay, so I'd like to move on to public comment now. Ida Talala.
Good afternoon. Thank you for allowing me to speak. I am a senior, as you can see, and I'm from Echo Park. And I can say that the new Echo Park Center, which is an outreach effort, is really working to coalesce and bring the seniors together. And more importantly, bring important information into the community that has been absent until then. I also am here to ask you to support the funding request in the budget session of the city. The department has been cut back, or the senior programs have been cut back for far too long and are showing frayed edges. We need to mend that before the next wave of seniors come. I would also like to say that stress and poverty are major things that seniors contend with, and that it contributes to depression, I'm sure. I'm not a medical staff person, but it also depresses them to the point that they don't look after themselves well. They're far too worried and distracted. So those issues need to be woven into this. And the mayor's initiative has been a wonderful wake-up call and a rallying point. And I am just delighted that y'all are here to assist us in this walk of aging. Thank you again.
Thank you. Wayne Spindler.
I put vote-in cards on each presentation. These presentations have nothing to do with one another. But you're going to cut me down to 2 minutes because you're just like Herb. But, you know, the good news is I recommend every city employee file your disability. 18% is too small. I want 33% this year. I'm shooting for a third. 1/3 of all of you that work in this building file for disability. Fuck these goddamn city cocksuckers. Get as much money out of them as you can because they are scum. And you know they're scum. So I say, go on, take everything. Just like the song, you see. This is what I tell people. Take everything. Everything from the city. Fucking take everything you can from the city. Every dime, the chairs, the computers, the lights. Because what you got running this city is a bunch of murderous, treacherous felons that belong in prison for the next 45 to 50 years. And you know what they do? They put a woman that used to work here in the U.S. Attorney's Office. They put another one in Lacey who gets money from Herb Wesson in the DA's office. They pay off everybody so they can shoot people like Gazelle Ford. They can accost people like me. So you could buttress a $4 billion budget of fraud and malice. And you guys sit here like you're going to help people. You have all the money in the world to help people, but you spend it on all of this stupid shit like going to federal court and defending defenseless actions and filing false criminal charges. You people suck. So go on, file more of those disability claims.
Thank you. Colleagues, I've been advised that due to the lack of quorum, we can take up only 2 more items. Item number 5, which is items for future discussion, and item number 6 for public comment. So we will move the agenda to item number 5. So the items for future discussion is your opportunity to let us know what you'd like to see in future meetings. Just to let you know that, again, if you'd like something on the agenda at some time in the future, this is your opportunity to let us know.
Maybe we can get someone from the personnel department to talk about their wellness promotion programs to see what they're doing. That's in correlation to what was just reported today from
Great.
the innovative team.
Great. Any other suggestions?
Hi, Commissioner Hawkes. I'm interested in getting an update on Measure H as far as the funding. I know they're starting to have discussions right now on the different types of funding streams that are going to be available through the measure that was just passed. And that's it for me for now. Thank you.
Great. Any other agenda items?
I think the Commission should discuss and develop a position regarding the repeal and replacement of the Affordable Care Act.
Great. Any other suggestions?
Yeah, I'm interested in if we had to memorialize this, but I'd really like to get in contact with Councilmember Rue from the Health Commission and just kind of get an update on what happened with the report. If you get a chance to report back to him or his committee and what the outcome was, I think that's important to get an update on the report.
A report on our annual report?
That was just done.
Oh, okay, great.
Yes.
Yeah, I'm supposed to be making a presentation sometime in the future. Okay, great. So now we will hear from Wayne Spindler on item number 5.
No guts, dickless, ballless fucking city attorney office. Where's Chris Lee from the city attorney's office? See, today I filed my 480-page answer to their fucking motion to dismiss in my lawsuit today against LAPD. Now, he doesn't want to be in the room. Did you know that when somebody to a party to an action files a criminal charge or even threatens to do so to gain an advantage in a civil lawsuit, that person could lose their bar card? Now, they're going to say, oh, well, we're the city attorney. We're not in a party litigation against Mr. Spindler, but you know what they forgot? They brought the TRO directly on behalf of Herb Wesson. Yes, I am in litigation directly with the Office of the City Attorney. And they filed a criminal complaint on March 29th, and on March 30th sent 20 police officers and assaulted me to gain an advantage in a civil case. It's called Rule-5100. And see, Mr. Chris Lee doesn't want to come in this room today and look me in the eye. Listen, rookie. Listen, rookie. See, I've been an attorney for a long fucking time, man. I go back before I became an attorney, okay? I did investigations. I did questioning. All that stupid-ass shit. I turned my life around. I became a civilian. I became somebody that my father could really be proud of. But you know what? I'm back where I started because of you and Herb Wesson and that fucking TRO and that criminal charge. Face me, damn it, and apologize. That's the way to start.
Okay, we will now move on to item number 6 for public comment. Adam Cohen from AIDS Healthcare Foundation.
Good evening. Happy Passover. My name is Adam Cohen. I am the Director of Advocacy and Policy Research for AIDS Healthcare Foundation. I just want to let everyone know that AHF is willing to renew its financial support for the LA City Health Commission if that helps keep things going. And as part of the Commission's responsibilities, I'd like to request that the Commission provide specifics about how the money would be used, particularly when focusing on public health issues such as what's near and dear to my heart, sexually transmitted infections. And just to provide some new information, STI rates in California are the highest they've been in 25 years. California's rates are highest among men who have sex with men and people between the ages of 15 and 24, especially in that age group, women. If untreated, of course, STIs can lead to chronic pain, infertility, and in some cases, like syphilis, death. And new data published by the CDC also found, and this just came out, found that 1 in 4 men and 1 in 5 women have a high-risk form of genital human papillomavirus, or HPV, which there is a vaccine available. It's a 3-dose vaccine, but less than half of young girls in Los Angeles County have received at least one of the doses of the vaccine. So these are serious issues that I will continue fighting for, and I hope the LA City Health Commission does too. Thank you.
Thank you. Wayne Spindler.
You talk about holidays and Passover and God. What do you do? What do you do to help people? Nothing. Nothing. You sit there and you prop up a defective system of failure. You can't, not one of you can even sit at the chair above you because you're afraid to sit in his chair, in his room. You've let one man take over this entire city. It's not even the mayor. You've let one man take over the city and turn it upside down, inside out, and bankrupt. So many people, look at all the education degrees combined in this room, and you haven't learned anything. You haven't learned anything in your lives. The combined knowledge base here is nothing. When you look at your degree on the wall, do you remember anything you were taught in school? You know, they taught us the rule against perpetuities. 24 years ago, I passed the exam. No interest is good unless it must vest, if at all, within 21 years in the life of being at the creation of an interest. See, I read my stuff. I wasn't one of these people that sat around and cliff noted my fucking way through life. I'm telling you from experience and training and education, this city's fucked up. And something needs to change for the better. Stop blaming Donald Trump. You got Donald Trump elected. You did it. You did it. You in Detroit and Chicago and the goddamn corruption did it. That's why you got Donald Trump. You elected Donald Trump. I didn't even vote for the son of a bitch.
Thank you, colleagues. So we will adjourn for lack of quorum. Thank you for coming, and we'll see you at the next meeting.